Hi, I am Sheila and you're watching a video regarding a Lynch syndrome. So, I want to introduce myself first. I am Sheila and I am 36 years old. I am currently living in Riyadh and I am browsing through YouTube and I came across to this video living with the Lynch syndrome. So I decided why not make one and so that I can help or maybe spread awareness regarding Lynch syndrome, which is very timely of what I'm experiencing right now and going through currently. So I was diagnosed with Lynch syndrome just last week, and through genetic testing. Just a preview of my family background. My grandfather died because of colonic CA. My mother also had endometrial and colonic CA. She also died at the age of 60. And my aunt as well had this colonic CA. So they were diagnosed at the age of 40s. Moving forward, I am working actually in pediatric ward and day surgery, and I was asked, because of shortage of nurses, I was asked to cross train to other hospital. So luckily I was moved to work in oncology clinic, and from that I had the opportunity to get tested. So I told the oncology doctor that I'm having symptoms of colonic CA. I had some changes in my bowels. I always had this abdominal discomfort, small stools, and I have the feeling of incomplete emptying of my bowels as well. And then the doctor first asked me to do this occult blood. So I sent a sample for occult blood and it turned out positive. So they had to do colonoscopy. So I had my colonoscopy and they found out that I have polyps. A little bit big. It was about 2.3 cm already, and at first they didn't remove it. So the doctor didn't remove it yet because they want to investigate further. They asked me to do more lab tests, CEA, CBCs, and also they asked me to do MRI, abdomen, and pelvis. So they want to make sure that before they remove it, they have a baseline as well. So I have done all of this, and after a month or two, they asked me to do the colonoscopy again. I was admitted as inpatient, and they want me to they want to remove it through endoscopy. They want to do polypectomy through endoscopy. So they have done this polypectomy, and then they did histopath for the sample that was taken from my colon. So it turned out to be positive of great hyperplasia. So the doctor advised me to have colonoscopy as frequent as every 6 months to 1 year. So after this, I was scheduled as well to have genetic testing. So I did this genetic testing as well, and it turned out to be positive of Lynch syndrome. So now I had this appointment last week, and they gave me a list of what to do and what to expect during having this Lynch syndrome. So at first I was so out of nowhere. I mean, I don't have any idea. At first, I don't have any idea that what to do, what is Lynch syndrome and everything. But at first, the doctor said they removed this first wave, and you will be expecting more waves to come for these polyps. So at first, I really don't understand and I don't get it because I am a nurse, yes, but most of our patients are ENT, Opta, and medical surgical. So I haven't been really had this oncology patients. So I am browsing through internet. I am reading a lot of articles about Lynch syndrome, and he gave me this list. So out of that list, the doctor said, the genetic doctor said, I have with Lynch syndrome, you have 60 to 84% of having this colonic CA, and 54% to 64% of having endometrial CA in the future. So, and there are some areas still that have some percentage. So it means that if you have Lynch syndrome, you are more prone of having the cancer. So they gave me an option actually. So of course in colonic you have to do frequent screening, at least yearly for the colonoscopy, because of course early detection will prevent you of leading to carcinoma. And also with the endometrial, by the way, I have one child, and the doctor asked me if are you done with your childbearing, because it is important to remove as well, better to undergo total hysterectomy plus oophorectomy. So without thinking further, so I agreed to have the surgery next week. It will be next week. I'm still having some doubts, but because of my cardiac condition as well, I underwent ASD closure, and my husband is not that really comfortable of me getting pregnant again, because he said it is better to have you than having another child. If you're getting pregnant and your life will be at risk, so it will be more difficult for me. So he actually agreed to have this total tabis 2 surgery. So I guess that will be all for now, and in the next video maybe I can share with you my journey of having this tabis procedure, and let's see how it will go. So I just want to have this video diary, so that at least in the future I can say that I overcome all of this, and as well to give hope to those who have Lynch syndrome, living with the Lynch syndrome like me. See you in the next vlog.